Good afternoon, everyone. Good morning to some of you. We're excited to launch this new funding opportunity, but before we get started, I'm going to pass it over to our Division Director, Dr. Leandro Mena, for some opening remarks.
Thank you, Melissa, and good afternoon and good morning to everyone. I'm Leandro Mena, the Director for CDC's Division of STD Prevention. Welcome to our informational call on the latest funding opportunities, support, technical assistance, and opportunities for program, policy, and communications to prevent STDs or stop STDs. As many of you are probably aware, cases for reportable STIs continue to increase. The diseases that we track are all at historic high. To turn the tide and increase STIs, we require involvement from everyone. CLC and publicly funded STI programs cannot do it alone. We also must re-envision how we support the development of our STD leaders, provide STI prevention services, and ensure we drive innovation to bring STI prevention into the 21st century. As such, we are pleased to share with you this latest NOFO to further expand efforts to stop STDs, as the new name states. Before turning back over to Melissa, I want to thank our stellar team in the STDP that led this effort and the Center for their ongoing support of this work. We greatly appreciate your time in attending today's session, and we look forward to seeing what we can accomplish in the next 5 years with the NOFO, and to receiving and reviewing your applications. Now, I'll turn over to Melissa Hable, the project officer behind Stop STDs, to get us started. Melissa.
Thank you, Leandro. So welcome, everyone, and thank you again for joining us today. So here is the agenda for our webinar, but before we dive in, I just want to go over some general housekeeping rules. We ask that you please hold all verbal questions until the end of the presentation. If questions arise during the presentation, please use the Q&A function. And lastly, if you could please use the chat feature before we begin to include your name and organization, that'd be greatly appreciated. So today's call will provide you with an overview of the NOFO, including covering the details, eligibility and application requirements, and important dates. We'll also have some time at the end to address any questions or clarifications you may have. And we also have Rhonda Burton from the Office of Grant Services on the line to discuss the details of procurement process. So the total project period for this NOFO is 5 years. We approximate a total project period funding of $5.75 million, and we approximate total fiscal year funding of $1.15 million. There will be no award ceiling set per budget period, and there will be no floor set per budget period. So we're expecting the approximate average award per component to be $200,000 to $250,000, and we expect to fund 1 to 2 recipients per component. Applications are due April 17th by 11:59 Eastern Standard Time. So this slide lists out all eligible applicants, and you can also refer to pages 24 to 20 of the NOFO. Bottom line is it's unrestricted to the categories listed above the red box. However, regarding eligibility of private entities, please note that the funding opportunity is for nonprofit private entities. Also, in order to be eligible, applicants must provide a chart to show the geographical location across the U.S. of their members, chapters, or networks and programs being implemented to demonstrate national reach, infrastructure, and organizational capacity to conduct the activities. We also ask that under component A, applicants include digital and social media data indicating the total number of followers and subscribers across platforms and characterizations of the type of followers. And social media data may be included that's not limited to screenshots, and it can clearly show how the organization's name, web link handle, and number of followers or subscribers. And just note that if these documents are not submitted, the application will be deemed non-responsive and will not move forward to phase 2 review. We are not requiring a letter of intent, but it is extremely recommended. It's very helpful to us. And the due date for the letter of intent is March 10th, 2023. You can send it to me at this email address here. So let's talk a little bit about the meat of the NOFO. This NOFO will support activities included in This NOFO is going to fund organizations with national reach that can provide technical to STD HIV public health programs on systems, policy, communication, and partnerships, special and emerging STD issues, and leadership, technical assistance, and training to advance national prevention objectives. It is a beast of a NOFO. It consists of 5 components. So component A is focused on communication and partnership. Component B is focused on policy, academy, and technical assistance. Component C is focused on technical assistance and capacity building. Component D is focused on special projects. And component E is a program director and leadership academy. And because I want to ensure ample time for Q&A, I'm not going to be reviewing the short-term and intermediate outcomes. You can refer to pages 7 and 8 of the NOFO, but here are long-term outcomes we hope to achieve through the NOFO. We want to increase capacity of STD HIV program staff to effectively communicate prevention messages to priority audiences. We want to enhance local, state, and national response to emerging and special STD-related issues. We want to increase the capacity of STD HIV public health program staff to engage in policy discussions related to STD and HIV program impact, effectiveness, and cost of implementation. We also want to increase adoption of more efficient and effective approaches to STD surveillance, prevention, and control programs, and equitable resource allocation among STD programs. We also are hoping to increase the capacity of STD program staff to assess, manage, and improve the quality of STD prevention and control activities in their jurisdictions, and also scale and disseminate best practices, and also increase the capacity of STD program leadership to serve as catalysts for change and demonstrate and communicate program accomplishments. So component A is focused on communication and partnership, and it will fund organizations with national reach to assist CDC in supporting STD programs in a changing public health and healthcare environment through enhanced communication efforts and the development of strategic national partnerships. The recipient will actively support communication efforts through appropriate in a complex landscape that includes state and local STD programs, national partners and stakeholders, and the general public. In coordination with CDC, we expect the recipient to help build communication capacities among STD HIV programs and support effective communication between programs in the CDC, programs and their priority audiences, and CDC and existing as well as new, diverse, and innovative partners. We also expect the partners the recipient the development and dissemination of timely, relevant, and culturally appropriate information on key issues in STD prevention, science, policy, and education to STD and HIV programs and other priority audiences as appropriate. The recipient will be expected to use established partnerships and communication channels to assist CDC with addressing emerging issues and special projects that affect STD programs nationwide, including but not limited to the DIS They also expect the recipient to partner and engage with a broad spectrum of national and local organizations, including but not limited to new, diverse, and innovative partners that promote health equity and expand the reach of our prevention messages for priority audiences. Here are a few examples, but more are listed in the NOFO. Examples of activities for component A could be conducting an environmental scan and needs assessment of STD programs to inform specific tactics, fostering communications to and between programs through the development and or maintenance of a secure online environment for information and resource sharing, and communicating to programs through weekly updates and other periodic communications. Component B will fund organizations with national reach to assist CDC in supporting STD programs in a changing public health and healthcare environment through policy education and the development of strategic national partnerships. So the recipient will actively support policy education efforts through material development, training of staff in state and local health departments, policy-focused partnership development, and education of policymakers. In close coordination with CDC, the recipient will develop, implement, and evaluate an annual policy training and education academy to educate STD HIV public health program staff on allowable approaches to policy and partnerships to promote opportunities that remove and reduce barriers such as stigma, also promote and expand access to HIV status neutral and holistic STD and sexual health services, to advance STD prevention's role in HIV prevention, and increase awareness and understanding of health systems and policies. We also would like the recipient to work with national and local partners to identify, evaluate, and raise awareness of policies and healthcare system factors that support equitable access and drive disparities in access to quality sexual health services. We want them to provide targeted policy TA to STD and HIV public health programs, to work with partners to raise the visibility of STD programs and their contribution to HIV prevention, to assist CDC in tracking state-level activity and impact on policies, focus on equity relevant to STD prevention programs, and also develop and disseminate educational and informational products. Some examples of this could include assessing state policies with a focus on the impact of policy on health equity, developing materials that support the ability of state and local programs to assess, educate, and implement policies related to sexual health and STD prevention, and provide a policy training academy and technical assistance. Component C will fund recipients to assist the CDC in providing a robust menu of capacity building opportunities and technical assistance to PEACH recipients to effectively and efficiently communicate and disseminate the latest science, policy, best practices, tools, guidelines, and other resources to recipients. In coordination with CDC, we expect the recipient to disseminate relevant policies, guidelines, tools, and training curricula that support non-stigmatizing, discrimination-free, culturally competent STD care, to monitor, evaluate, facilitate, and support management of learning communities and TA and capacity building, facilitate and evaluate peer-to-peer technical assistance for recipients, and provide support for learning communities and communities of practice. Also identify and document STD program success stories, provide training and technical support to jurisdictions to address disparities in access to quality sexual health services, and establish and maintain a DIS registry and participate in efforts to certify the DIS workforce. Examples of this could include working to conduct routine assessment of technical assistance and capacity building among recipients, and identifying topics and skill sets to be addressed. Also assisting CDC with planning, promoting, and facilitating quality or performance improvement initiatives, such as the peer-to-peer sharing in communities of practice I mentioned earlier. Component D will fund recipients to support special projects, partnership engagement, and communications in response to and unaddressed issues that can impact STD and HIV programs. And by unaddressed issues, this means the epidemic of racism that impacts public health and can influence how people access STD and HIV services. Such efforts are essential in adhering to CDC principles to promote health action and communication, conduct and disseminate exceptional science, and serve our partners. Some of the strategies under component include utilizing partnerships and communication channels to address emerging issues that affect STD and HIV programs with culturally competent and linguistically appropriate messages, identify and convene tiers of national partners, old, new, and diverse, to address these emerging and unaddressed issues, establish a process for engaging new partners and talking points for their needed collaboration in STD prevention and control, develop a communication plan to quickly and effectively disseminate easy to understand messages and materials related to these emerging issues and outbreaks. Also working with CDC, national and local level partners to identify and prioritize unaddressed issues. Also supporting and piloting demonstration projects that address these emerging and unaddressed STD HIV issues and describing best practices. And finally, providing support for performance and quality improvement and evaluation activities for STD programs. Our last component will establish a leadership academy to provide ongoing leadership training and support to STD and HIV program directors and leaders working in state, tribal, and local territorial health departments. It's really important that we draw a distinction between leadership and management here. Leadership is focused on vision and management is focused on implementation. And while the ability to implement a plan is a critical aspect of leadership, management skills are a subset of leadership skills. In coordination with CDC, under component E, the recipient will establish a leadership academy for STD and HIV program directors and leaders, state, tribal, local, and territorial health departments. They'll develop leadership competencies for STD and HIV public health program directors. And they'll also develop, implement, and evaluate leadership training and continuing education programs for directors to increase knowledge and understanding of leadership, strategic planning, program planning, critical thinking, HR management competence. Finally, the recipient will be expected to establish and evaluate a mentorship program for STD and HIV program directors and leaders. And they'll also be expected to establish a STD HIV program director orientation with technical assistance support for new directors. So now for our expectations, this applicant should possess a variety of organizational skills and strengths to be successful in executing this funding opportunity, including tailored experience specific to STD programs. For all components of the NOFO, CDC expects applicants to demonstrate the relevant experience and capacity. And capacity to implement means readiness to quickly begin the work, such as current organizational staff rather than projected. Applicants also must have the ability to support STD public health programs across the country rather than focus on a particular locality, state, or region. And they must provide a chart to show the geographical location across the US of its members, chapters, and networks, as I mentioned earlier. Organizations and applicants are also expected to describe their financial management system that will allow proper funds management and segregation of funds by the program. They're expected to demonstrate their ability to manage any procurement efforts in the proposal, including the ability to write and award contracts in accordance with applicable grants regulations. They must include CVs and resumes of staff proposed for the work, as well as an organizational chart. They must, for each component, include budget information, including staff time, consultants, travel, and other substantial expenses. And applicants must include potential conflicts of interest from other sources of funding. Applicants must also include a detailed work plan for the first year of the project and a high-level work plan for subsequent years. A work plan must be included for each component applied to. Now I'm going to go through what's specifically required for each separate component. So for component A, applicants must describe the scope of communication channels and provide opportunities for regular and ongoing communication with state, tribal, and local public health prevention programs. They also need to describe capacity to reach and engage with a broad and diverse set of relevant partners, experience with effective risk communication related to priority and emerging issues, including the ability to communicate and disseminate best practices, and experience in organizational knowledge addressing social determinants of health. Under component B, the applicants must describe experience and knowledge about national policy environments and the impact of policies on STD and HIV programs. They also must describe their capacity to reach and engage with governmental and non-government leaders who make decisions in public health. Also, their history of training capabilities and their history of working with national or local partners to identify, evaluate, and raise awareness of policies and healthcare system factors that support equitable access, and describe their experience and knowledge addressing social determinants of health and working to eliminate health disparities and inequities. Under component C, applicants must describe their experience in TA and capacity building with public health STD programs. They also need to be able to describe their ability to develop policies, guidelines, tools, resources, and training that support the workforce. Also, their organizational experience with monitoring, evaluation, and management of learning communities. as well as their experience and organizational knowledge addressing social determinants of health and working to eliminate health disparities and inequities. For component D, which is focused on special projects, applicants must describe their capacity to reach and engage with a broad and diverse set of relevant partners. They also need to have experience with effective risk communication related to priority and emerging issues, including the ability to disseminate best practices. They also need to describe their organizational experience with developing, piloting, and implementing public health projects in real-world settings. And they need to be able to describe their adaptability to handle emerging issues and changing shifts in the national, state, and local economic and policy environments, including a continuing evolving healthcare landscape, as well as their organizational experience and knowledge addressing social determinants of health and working to eliminate health disparities and inequities. Finally, in component E, which focuses on the academy, applicants must describe their experience in organizational knowledge and leadership development and training, be able to describe their experience in training development, delivery, and assessment, including experience using new technological advances for the delivery of training, and experience in developing instruments to assess knowledge acquisition and improvement in skills. They must also describe their experience and knowledge about addressing unconscious bias, racism, ethics, cultural competence, and social responsibility. Now I'll talk a little bit about collaborations. Engaging in strategic policy partnerships with other organizations working in the intersecting areas of HIV, family planning, maternal health, adolescent health, school health, violence prevention, substance abuse, mental health, LGBTQ+ health, and correctional health and primary healthcare may be expected in some areas. With other CDC programs and CDC-funded organizations, recipients are going to be expected to work directly in support of and with staff from CDC-funded state, territorial, local STD HIV programs as described in components A through E. And if multiple recipients are funded through this opportunity, awardees will be expected to participate in regular coordination calls to ensure lack of duplication and promote working towards the same goals. In regard to reporting and monitoring, this is all outlined in detail in the funding announcement and explains what recipients will be required to report on. CDC will monitor the cooperative agreement in partnership with the recipient to ensure mutual success in achieving the program's outcomes. We will assess process and short and intermediate term outcomes through collection of qualitative information through discussion with recipients. Recipients will also provide process and outcome documentation of their program activities and outcomes. Process and outcome measures are proposed and will be finalized in the first 6 months of the period of performance, and recipients will be expected to submit monthly progress reports and an annual evaluation report to CDC using the templates provided by the CDC team. So in regard to application and submission information, please make sure you read carefully pages 26 through 27 of the NOFO to make sure that you're registered appropriately. You have to have a unique entity identifier, be registered at SAM and at grants.gov. As I mentioned earlier, the application deadline is April 17th. Your application must include a project abstract, a project narrative, it's a maximum of 15 pages, and your application appendices can include letters of support, CVs, org charts, or other supporting materials, and they're not page maximum. Please note also that applicants are required to include the following documents in their application package: table of contents, as I mentioned, the summary, the project narrative, the work plan, budget narrative. Other materials also include the digital and social media data for component A, applicants only, as well as CVs, resumes, organizational chart, and membership chart. Please note that if your organization is applying to multiple components, which is allowed, you must submit separate and distinct applications to grants.gov, including attachments. In regard to funding restrictions, this is all in fine print on page 36, but I do need to emphasize that award recipients are prohibited from using CDC HHS funds to engage in any lobbying activities. So how will applications be reviewed? All applications will be initially reviewed for eligibility and completeness by the Office of Grant Services, and non-responsive applications will not advance to phase 2 review. CDC will use an objective review panel to score and rank the applications in accordance with the following criteria: approach, evaluation, and performance measurement, and the applicant's organizational capacity to implement the approach. The budget and budget narrative will be reviewed but not scored. And for complete details on the phase 2 review process and the scoring rubric, please refer to pages 37 to 42 of the NOFO. This slide basically says that if you get you'll be notified by CDC's Office of Grant Services. And if you are not a recipient of the award, you'll also receive an email from them too. So I just want to go through a final review of the important dates. If you're interested in applying, again, it's recommended but not required. Please submit a letter of intent by March 10th. And the application deadline is April 17th. And then the award date is August 15th. These are some resources that may be helpful to you. The grants.gov NOFO page as well. We have a DSTDP funding opportunities page where we may include some updates about the NOFO throughout the process. And then there is some resources on budget preparation guidance. In case you need to reach us, these are agency contacts. Feel free to email me. And also if you have specific questions about finance or grants management or budget assistance, please reach out to Rhonda Burton. Or if you have submission difficulties with grants.gov, please reach out to support@grants.gov. So before we move to the Q&A session, I just want to thank a number of colleagues for their work on this NOFO. This was definitely a team effort. Jeff Hitt, Shantae Wright, Shamia Moore, Nikki Mays, Selena Smith, Jennifer Lidovic, and Raul Rumagera. I also want to include a huge thank you to Erin Williams and our extramural non-research unit. And thank Anna Madsen and Amber Harrell for helping get the webinar ready. And also a huge thanks to Zykia McCurdy at INPIN for helping us host this webinar today. So Zykia, now we can open it up for Q&A.
Okay, so we have our first question in the Q&A. Will proposal reviewers give higher scores to qualified applicants that are equipped to address multiple components of the NOFO?
Can you repeat that question, please?
Yes, of course. Will proposal reviewers give higher scores to qualified applicants that are equipped to address multiple components of the NOFO?
No. Objective review panel will be scoring each component application separately. It will not play into a factor as to whether you applied to multiple components or not.
Our next question, could you clarify the page limitation? I'll ask that one first.
The application can be a maximum of 15 pages, but that does not include your fees.
So if our organization is going to apply for multiple components, is the page 15 limit 15 pages per component?
Correct.
Okay. A follow-up question. Could you say more about what you mean by separate applications per component?
What I mean by separate applications per component?
Yes.
For each component that you're applying to submit a distinct application. So let's say you're applying for component A and you're applying for component C. You can duplicate resources, but you still have to submit everything that's required of an application for each component.
All right, and for our next question, to confirm, there is no minimum or maximum components that we can apply for?
Correct. You can apply for all 5 components.
Awesome. For our next, it says on page 31 of the NOFO, it states multiple component NOFOs may have a maximum of 15 pages for the base, subsections of the project description that the components share with each other, which may include target population inclusion and collaboration, and up to 4 additional pages per component for project narrative subsections that are specific to each component. This seems to contradict the statement about separate applications. Can you explain that a bit more?
I'm going to have to consult with INRU about this, but we will post some clarification on a follow-up FAQ.
Perfect. I'll make
Yes,
sure.
Melissa, I can confirm that that is true. So
Okay.
for any, for the base 15 pages, any additional component, you can provide an additional 4 pages per component that you're applying for. But I agree, Melissa, this will be something that we can clarify further in our FAQs.
Okay.
Thank you. Our next question, if an organization is applying to multiple components, those must be fully separate applications, not one application with a separate work plan and budget.
Correct. And Erin, please, this is what I'm a little concerned about, the 4 additional pages contradicting. But it's my understanding from reading the text of the NOFO that if you apply for one component, you have to submit a budget, work plan, everything separate for each component you apply for.
And the last part is, and there aren't 4 additional pages, as it also says in the NOFO.
We're gonna have
Sorry, I'm pulling it up now. I believe what the boilerplate language in all of our NOFO states is that the work plan, the budget is definitely not included in the page count. I need to check on the work plan. Stand by.
Our next question is, monies can be used for incentives if needed? Or can money be used for incentives if needed?
I would have to go back and look at the funding restrictions. I think that there is some type of flexibility on incentives, but I don't have a good answer for that right now, and we can follow up with that in the FAQs unless Rhonda Burton wants to weigh in from OGS.
Good afternoon. I'm going to defer to Melissa on that in terms of the FAQs. So we will go back and take a look at that and the information in NOFO and post that so that it's there for everyone to see, because I don't want to speak preliminarily on that. Thank you.
Thank you. We have another question. Are position descriptions required as an attachment?
I think that the NOFO states that you should describe your staff roles that they plan to play, and it would be an attachment, so it doesn't count within the page limit.
Okay, thank you. So we don't have any other questions in the Q&A right now. So I'll invite the attendees, please put any questions you may have in the Q&A, or feel free to raise your hand to ask your question out loud. Araceli?
Hi, yes, good morning. I have a question. So when we're trying to align or write down our objectives and goals, we need to align them to the strategic plan 2022-2026 from the CDC. I know that these were few links that were attached to that, the grant information, as well as the sexual transmitted infection national strategic plan 2021-2025. Do they have to be aligned to these two links?
You don't have to link directly to them. It's encouraged that when you think about your activities that you're proposing, that they do align with our division strategic plan as well as the STI national strategic plan. But most importantly, your activities need to align with what's proposed in the NOFO as well as the proposed short-term, intermediate, and long-term outcomes.
Perfect. Thank you so much.
We have another question in the Q&A. Is it possible that one organization could be awarded multiple component awards?
Yes, that is possible.
Thank you. So once again, I want to invite anyone to raise your hand if you have a question, or feel free to drop it in the Q&A.
I wanted to quickly circle back to the page count. The work plan is included in the page count for each component that you apply for.
Thanks for clarifying that. Next question, could you elaborate a bit more on the capacity to implement peace in relationship to national reach, especially for local government agencies?
Sure. Yes. Sorry, I was looking at the question again. The idea is that the recipients we fund will have the ability to, will have national reach. So, and that they won't just be focused on a specific geographical location or area. So it would be beyond local health departments and local government agencies.
A clarifying question, is that for all components?
I think there's so many components. I would have to go back and double check, but I think it does apply to a lot of the components.
Thank you. Do we have any more questions? Okay, I'm not seeing anything else. Oh, we have one more that came in. To find out the answers to the unanswered questions, refer to the FAQs.
Correct.
Perfect. And another question. So the work plan is part of the narrative.
Yes, it's part of the page count.
Thank you. How does the membership chart and organizational chart differ?
I think for organizations who are interested applicants that are more of a membership organization, that would be different than how your organizational structure is set up.
Our next question, will there be examples of scopes of work that would be a good fit for the project shared?
I don't understand the question. I'm sorry.
I think they're asking if there'll be like examples of what would be a good fit for the project.
There are examples of activities for the strategies listed. So I suggest you take a deeper dive and look at the NOFO under each component and what's suggested.
Okay, thank you. All right, let me just have a follow-up. I'll have that on the Q&A for the FAQs. All right, do we have any more questions? All right, we have a hand. Araceli?
Hi, sorry, just to circle back on that question in regards to reach national level. We are a very small county with a lot of our infrastructure is lacking, especially in our epidemiology department. And will any of these components, just at the top of your head, has to reach national, or is there might be one or two that it's not expected to reach that? Not that we wouldn't try, but being realistic with the needs that we have in the community and what we have available as a division. I just want to know if it would be something even feasible for us to apply.
Well, we are looking to partner with organizations that have national reach.
Thank you.
All right, we don't have any more questions right now. Please feel free to raise your hand or add anything to the Q&A. All right, it looks like the questions have slowed down. So Melissa, I'll hand it back to you to close us out.
Great. Thank you all so much again for joining us today. I apologize again for some of the ambiguity around the page limits, but we will definitely get clarification on that and put it in our FAQ. We also look forward to receiving your letter of intents, and our objective review panel looks forward to reviewing your applications. So please reach out if you have any additional questions. My contact information in the slide decks, and that information will be posted to our funding opportunities page at a later date. Thank you.